originally from Nebraska, grew up on a farm, but got drawn to Billings basically through the quality of life, the surrounding area, and really I kind of looked all over the country, and I was quite happy with finding Billings. Well, the nicest thing about Billings, Montana in general is there's so much to do. There's skiing, there's hiking. I like to go hunt and fish, and that's nice. The other good thing about this area of the country is everybody is just so incredibly nice, and it's been great being able to meet both patients and colleagues. The nice thing about Billings is it's big enough that you get almost anything you want, and yet it's small enough that I run into patients and go have fun with, I see patients at the shooting range. But the beauty of Billings is, although it acts like a smaller town, it really draws from the state and Wyoming and the Dakotas, and you end up acting as a much bigger community, which allows us to present a much better care. I've always been interested in medicine, and the reason I've been interested in medicine is, especially orthopedics, is you have a great opportunity to fix things. So when I grew up on a farm, something broke down, you were able to fix it. And that's the same thing with orthopedics. Something breaks down, be it your hip or knee, you're able to replace it, you're able to fix it, person gets up, they're better, they go about and live their lives. And so I've always been interested in orthopedics specifically, more so than other types of medicine, just for that reason. The wonderful thing about total joints is literally you have someone who hobbles into your office and are miserable with every step, and you evaluate them, they go to the hospital, and for instance with hip replacement, they're up and walking that afternoon and they feel like a new person. Literally we will have patients up walking the same day, and the pain that they have will be gone. They'll have some incisional pain, don't get me wrong, it's not the easiest thing in the world, but they'll be up and walking, and often patients go home in 1 or 2 days and they're back to their normal activities, and where they were miserable, they're now functional. So when I was looking at all over the country in terms of where to go, I really wanted to have an opportunity to do subspecialty medicine. So that was a major prerequisite for me choosing to come here. And really, if you look all over in different places, there's people who do part-time joint replacement and there's people who do full-time joint replacement, and I think the majority of studies will say that you're better off with someone who does it exclusively, and that's the type of medicine I wanted to provide. Why would I take my Porsche to the John Deere mechanic? I would rather take my Porsche to the Porsche mechanic. Not that I have a Porsche. Ortho Montana has a wonderful subspecialty format, and really what that format is it's more of actually a big city medicine type format. So when you're looking across the country, in this region, there's Denver, there's Seattle, there's Spokane. These are the places that have specific subspecialty orthopedic care. And really, besides Ortho Montana, that's where you have to go to get that care. So when I was looking throughout the country, I really wanted to be able to be in not a small town, but a med-sized town, and yet provide big city cutting-edge medicine. And so we're able to do that here in terms of subspecialty care, and no one else does that. And I don't know that people actually recognize that. And if you look at the people who graduate from orthopedic residencies, something like 80% of them are going into subspecialty training. Besides Ortho Montana, the rest of the area is behind in terms of providing that individualized, centric care. I've had that wonderful opportunity to meet patients from everywhere. I have a significant amount of patients from northern Wyoming. I've had patients from Dickinson, up in the Balkan area, White Sulphur, kind of throughout the state. And I really enjoy it because it's nice to be able to meet everybody from these different areas. It's nice to be able to serve such a large area. And to be honest with you, I love dealing with the ranchers, farmer community. It's kind of what I'm used to, number one. And number two, it's always pleasurable patients. It's hard to have a problem when you're a rancher or a farmer. Just because you can't work doesn't mean the work stops. So I do understand that really you need to get back, and we need to get people back going as quick as possible. I see a lot of patients who are brought in by their family members and by friends, kind of kicking and screaming, so to speak. And a lot of that is a mentality of, I don't need to go doctor, you know, it'll get better on its own. And oftentimes we'll fix them, they'll get better, and they refer and they say, I should have done this years and years and years ago, and no way I'm going to wait as long as I did before. There's no reason to be miserable in life.